All right, we're outside the United States Capitol. We're in a history-unmaking event. The Republican Party pushed forward and passed by a vote of 217 to 213 what they would call a replacement bill for the Affordable Care Act. If you have any questions about the process that led up to this or what's in the bill, put them into the comments section. Eric will read them out to you. But essentially what happened is that over the course of the last week, there was a flurry of changes made to the underlying bill on top of some traditional old school whipping that went on from the House Republican leadership, flipping people who were public no's to yes votes. The significant change that they made is an interesting one from a policy perspective. So I'll talk about that for a minute, and then we'll take some questions. Basically, what Republicans have done here is said that if a state wants to opt out of the Affordable Care Act, they can do so. But if they do so, that means people with pre-existing conditions no longer have protections. They must create what's called a high-risk pool. Now, once you have accepted the market-based framework of the Affordable Care Act to begin with, you've kind of already ceded the ideological ground to Republicans. This was an idea that the Heritage Foundation came up with in the beginning. So Democrats aren't really arguing on an ideological plane at this point. They're arguing on a utilitarian one. Will the plan deliver effective health care for people who need it at an affordable rate? That is kind of the question by which a replacement to the Affordable Care Act from the Republican side would be judged. The replacement from the Democratic side at this point would be something like single payer or Medicare for all. So a state that gets a waiver from the Affordable Care Act would need to create what they're calling high-risk pools. So a high-risk pool is something that somebody with a pre-existing condition would go into. Now, the theory here is that insurance companies can lower premiums on everybody if you take the sickest people out of that pool and have the state pick up the tab for those. That is, interestingly, in some ways, a fundamentally leftist socialist idea that you would be socializing the risks here. Now, it's a socialism with an American twist because you are privatizing the profits, but socializing the risks is all about what the New Deal is about. Medicare and Medicaid, in fact, are versions of high-risk pools. Medicare is a high-risk pool for the elderly, 65 and over. And what that does is it allows premiums for people under 65 to be a lot lower. But if you didn't have such a thing as Medicare, younger people under 65 would be paying more. So in theory, this is not actually a radical change. The rub comes in that Republicans are typically not willing to fund high-risk pools. So it's a pool without any water in it. And anybody who's accidentally dived into one of those suckers knows how that works out. In states where they have set these up, Paul Ryan refers to Wisconsin all the time that used to have a high-risk pool before Obamacare. It had waiting lists of tens of thousands. If you are somebody who has a pre-existing condition and needs health care, being on a waiting list for a couple years can be a death sentence. And the reason they have the waiting list is because they're not serious about these being a way to treat people treat sick people or treat people with pre-existing conditions. Instead, it's a way to just pretend that they're dealing with that problem and actually effectuate a massive tax cut. So theoretically, there would be nothing wrong if they actually funded these things at a mandatory level and said, nobody who is in these high-risk pools is going to pay more than X, and the government is going to pick up the tab for it no matter what it is. That's not what they do. They say that they're going to give us something like $130 billion over 10 years, which is a hilariously small amount of money when you're talking about a market as big as this one. The Republicans say that the entire reason that premiums have been driven up are the regulations requiring that you cover these pre-existing conditions and that insurance companies not be able to charge more for these people. So if they think the entire problem is related to this, and they can solve it by spending about $10 billion a year, $1 billion a month, a total drop in the bucket, then they're lying about something. They're lying about what the problem is, or they're lying about whether or not their solution addresses the problem. And I'll tell you right now, it's the latter. They have not put enough money in. And so if this actually did become law, and we can talk about why it won't in this form, then people who have pre-existing conditions would definitely suffer.
So yeah, tell us why is it unlikely to pass?
Right. So the Senate has already said, the Senate moves at a glacial pace on legislation, but in its messaging, it's pretty instantaneous. And a number of senators have already said this afternoon, we appreciate what the House has done. Good for them. We're going to write our own bill. And so they will write their own bill. It'll probably be based on this bill that's already been conceptualized, called Cassidy-Collins, from 2 Republican senators. And then they will, if they can pass it, then it would go to a conference committee, and where it would be negotiated between the House and the Senate. And the idea being that the Senate would not really accept anything remotely similar to what the House sent over. For one, the House bill defunds Planned Parenthood, or a better word for it would be tries to destroy Planned Parenthood. And Susan Collins, Lisa Murkowski have already said that they will not vote for something that does that. So that takes them down to 50. Rob Portman from Ohio has said he would not vote for anything that takes away Ohio's Medicaid expansion. So right there, you're down to 49 votes, which is not enough for passage.
So why did they do this then?
So I wrote a piece about this a couple weeks ago trying to explain why. And basically it's because they had to do something politically. At least that's what they felt. For 7 years, they had been promising that they were going to repeal Obamacare as soon as they took power. They took power, they tried, they didn't even vote on it, and gave up. And they took so much heat from their base for that incompetent, embarrassing failure that they felt like we need to get something down on paper and we need to pass it through the House of Representatives, or else we're going to look like terrible fools and we'll lose our majority. Now, the problem they have is that putting their name to this bill and passing it also puts their majority at risk. So they had 2 difficult political paths to walk, and my guess is that their reasoning was, well, look, we already tried on this thing, so Democrats are already going to hang it around our neck. So why not try and pass it, since we're going to get blamed for it anyway, rather than try and be losers and also get blamed for it.
Do you think there was any thinking that it gives the moderate Republicans in tough districts a chance to vote no and maybe survive 2018?
So does what give moderate Republicans a chance to vote no?
Today's vote.
So, not many moderate Republicans. So, did this give a chance for moderate Republicans to vote no and save their seats? 2 things. Not many moderate Republicans actually did vote no. I was up on they have a big bulletin board of the votes that are going as it happens, and I was watching Darrell Issa closely. Yesterday, he said none of your business to reporters when asked how he was going to vote. Today, he didn't vote until the very, very end, which politically was probably a mistake because when he voted, it went from 215 to 216. I mean, he put it over the top when he seemed like he would much rather kind of not even be there at that moment. So a lot of these moderates ended up casting yes votes that they're going to pay for. But it's also a myth that the way you vote matters. So if you think back to Obamacare in 2010, a bunch of conservative Democrats thought, I'm going to vote no on this, and that's going to save my ass come November of 2010. Almost all of those people that voted no on Obamacare lost. It is a pathetic argument to go to your constituents and say, I know you didn't like what my party did, but I voted against it, even though it passed, so reelect me anyway. Like, constituents are like, well, then you're a feckless loser. Like, you're a member of a party that you can't even influence. So that's great that you voted no, but the bill still passed. So I'm going to send a message by voting for your opponent, to send a message to hurt the party. So I think they're going to, even people who voted no on this are going to pay the precise same cost.
Okay, sorry you couldn't hear the earlier question, so this is the last one for you. Joe Crowley, as the leader of the Senate and the House Democrats, said this was not a policy vote, this was a politics vote. And tell me if you agree with that, or which one is more, and then what's the result, down that politics road or down the policy road? Or is there actually an impact for both?
I mean, we'll see. You don't, in this political climate of uncertainty, you don't want to necessarily ever rule anything out. a week ago, they didn't have the votes for their bill. They made a bunch of changes to their bill and did a bunch of magic behind the scenes, and eventually they got the votes for it. So they don't currently have a path to passage for any particular thing that could become policy. That doesn't mean things couldn't change in some kind of radical way, and it actually becomes a policy issue. But I think Crowley was probably right that at this moment it was a political calculation. Like, are we better? Like, we've told our base for 7-8 years now we're going to pass this thing. Are we better off trying and failing, or and getting thrown out of office, or trying and succeeding and getting maybe thrown out of office slightly at a slightly lower rate? Right. Yeah, so thanks, everybody. If you want to read more of the analysis, sign up for my newsletter, which you can find on my TYT bio. I'll be writing up some thoughts on that, but it'll be more or less along these lines, maybe with a little bit better grammar. So thanks, everybody. I'll see you later.